Welcome to the New England Journal of Medicine at the 2024 American Heart Association Scientific Sessions. I'm Stephen Morrissey, Executive Managing Editor of the journal, and I'm with Eric Rubin, Editor-in-Chief, and Jane Leopold, Deputy Editor. We're talking about the OPTION trial, left atrial appendage closure after ablation for atrial fibrillation. Jane, tell us how left atrial appendage closure works and why it might be advantageous.
Well, a left atrial appendage closure device is an implant that's designed to close off the left atrial appendage. Now, this is a small pouch, and it's a nidus for thrombus formation. So for patients who have atrial fibrillation, this is often the site where there is a lot of clot and high clot burden. By closing off the left atrial appendage, any thrombi that have formed are blocked from embolizing and thereby reduce the incidence of stroke. Now, these devices are implanted percutaneously. They have a high success rate for sealing the left atrial appendage. And although they require some degree of anticoagulation after implantation, and this can range from a few weeks to a few months, after that, patients don't need to take these medications. So they're a great alternative for patients who are at high bleeding risk or who can't take anticoagulation medications long term.
Eric, this study asked whether left atrial appendage closure would benefit patients with atrial fibrillation after an ablation procedure for atrial fibrillation. So how did it work?
Steve, patients with elevated CHA2DS2-VASc scores with atrial fibrillation who had a recent ablation procedure for atrial fibrillation, as you said, were randomized between oral anticoagulation and left atrial appendage closure. There were two primary outcomes: safety as measured by non-procedure related major bleeding or clinically relevant non-major bleeding, which was tested for superiority, and efficacy, a composite of death from any cause, stroke, systemic embolism, and all of these were tested for non-inferiority. The outcome was measured at 36 months. There were about 800 participants in each group. At 36 months, there were 65 safety events in the left atrial appendage closure group and 137 in the drug-treated group, while the primary efficacy outcome occurred in 41 and 44 patients respectively. Statistical testing found that left atrial appendage closure was superior for the safety endpoint and non-inferior for the efficacy outcome.
So Jane, should this motivate cardiologists to perform left atrial appendage closure in this group of patients instead of using anticoagulants?
Well, Steve, what I think this study really tells us is that for patients who have undergone a catheter ablation for atrial fibrillation, that the implantation of a left atrial appendage closure device is really a reasonable alternative to longer-term anticoagulation, and that it can be done safely. So I think this now adds to the armamentarium of procedures and devices that we can use for patients who are having a catheter ablation.
Jane, this was an extended trial and went on for 3 years. But of course, these patients are at risk for recurrent atrial fibrillation that may be asymptomatic throughout their lives. Was this trial long enough to make you comfortable with the conclusion for a lifelong disease?
Right. So also a very good question. And I think that the 3-year data is encouraging, but what's also encouraging is what we know from other clinical studies of left atrial closure devices, and that they reduce stroke compared to no closure devices at longer term. So some of the original studies that when they were presented 4 and 5 years ago had 5-year data showing that the devices were efficacious. And now we're even farther out than that, and they still look good. So I think with that encouraging data, I think that we will be able to follow patients after catheter ablation with a closure device and hopefully extrapolate some of those results to this patient population.
Thank you, Jane. Thank you, Eric. This study can be found at nejm.org.